Good morning. I'm Dr. Karen Bierman. I'm a clinical psychologist in San Antonio, and today the topic I'm going to be addressing is Alzheimer's and other dementias. Alzheimer's is the most popular, the most kind of common type of dementia, but there's actually quite a few other types which I'm going to touch on. Many disorders, some are cured. Many other disorders or medical problems or metabolic imbalances can actually cause dementia, so it's not always Alzheimer's. So it's kind of helpful, to know. Dementia is actually a neurological disorder that affects your ability to think, speak, reason, remember, and move. So it affects your speech. It affects your ability to encode information that's coming in, your reasoning ability, your executive functioning, your ability to kind of have a dampen on your emotions. Like if you have an emotion, normally we can keep ourselves from reacting, but sometimes when people have dementia, they have poor executive function. They can't actually control their reactions or their anger or some of their emotions. They just act out rather than having a filter. And also, dementia can affect your memory and your ability to move. It could affect your gait and your walking ability, and then it could become even more progressive and affect the whole movement on your side of your body, so that you wouldn't be able to move or you wouldn't be able to walk. Alzheimer's is the most common form of dementia, as I mentioned before, but other conditions can cause similar symptoms, and some disorders worsen with time, and some cannot be cured. Some can be cured and resolved, like a metabolic imbalance or low blood sugar, or Wernicke-Korsakoff's dementia related to alcoholism. If somebody stops drinking, some of the symptoms could resolve. Other types may respond so well to treatment that the symptoms can be completely reversed. After Alzheimer's dementia, the four most common types of dementia are vascular dementia and Lewy body dementia. In vascular dementia, what happens is the arteries feeding the brain become narrowed or blocked, and in this case, the onset of symptoms is usually really abrupt, frequently occurring right after a stroke. So there's a definite time point with the onset of the symptoms. Although some forms of vascular dementia can progress so slowly that they're difficult to distinguish from the Alzheimer's dementia. And some people have both Alzheimer's and vascular dementia. Vascular dementia often causes problems with thinking, language, walking, bladder control, and vision. And preventing additional strokes by treating the underlying diseases, for example, high blood pressure, may halt the progression of the vascular dementia. Now, the Lewy body dementia. Lewy bodies are abnormal clumps of protein that have been found in the brains of people with Lewy body dementia. So they're little pockets of protein in the brain. And also, Lewy bodies can be in Alzheimer's and Parkinson's disease. And this suggests that the three elements are related, that Lewy body dementia is related to Alzheimer's and Parkinson's. And an individual could actually have Lewy body and Parkinson's, or also Alzheimer's disease. And some people with Lewy body dementia have experienced improvements in symptoms when treated with Alzheimer's or Parkinson's medications. And some of these medications can help prevent the further decline. Alzheimer's isn't reversible, but medications can help stop the symptoms from getting worse. They can stop the memory problems from getting worse, or some of the other symptoms. Another type of dementia is frontotemporal dementia. And this affects the frontal and temporal lobes of the brain. And because it affects the areas of brain that are responsible for judgment and social behavior, frontotemporal dementia can result in socially inappropriate behavior. Symptoms of this form of dementia, which runs in families and is hereditary, usually appear between the ages of 40 and 65. And this it can affect the emotional filter that we have, rather than acting out on our emotions. We normally have a filter. And this can affect our ability to, think socially. Here are some less common brain disorders that can result in dementia. There's Huntington's disease, Parkinson's disease, which I've already mentioned, Creutzfeldt-Jakob disease, and AIDS. Symptoms of Huntington's disease, which is a hereditary disorder, typically begin between the ages of 30 and 50, so it's relatively early adult onset. And it can start with mild personality changes. And as the disorder progresses, a person with Huntington's develops involuntary jerky movements, muscle weakness, and clumsiness. And dementia commonly develops in the later stages of the disease. So it starts out with this muscular kind of physical symptom. Parkinson's disease, people with Parkinson's may experience stiffness in the limbs, shaking at rest or kind of a tremor, speech impairment, and shuffling gait. Some people with Parkinson's develop dementia later in the disease as well. Now, Creutzfeldt-Jakob disease, this is an extremely rare and fatal brain disorder that belongs to the family of human and animal diseases known as the transmissible spongiform encephalopathies. And it's particularly common in Great Britain, and it's believed to be related to the human consumption of beef cattle with mad cow disease, which leads to the encephalopathy. And finally, with AIDS, people in advanced stage AIDS often experience symptoms of dementia related to the disease. Other conditions that can cause dementia-like symptoms can include reactions to medications. Some medications have side effects that mimic the symptoms of dementia, and a single medication, particularly in an older adult or in someone whose liver fails to eliminate all the toxins, if they can't metabolize the medication normally, then they can have these symptoms of dementia. Or interactions between two or more drugs can cause dementia symptoms. But usually these are reversible as soon as the medications get sorted out. Other causes of dementia can be metabolic abnormalities, like decreased thyroid function, hypothyroidism, can result in apathy or depression that mimics dementia. Hypoglycemia, a condition where we have extremely low blood sugar, where there isn't enough blood sugar in the bloodstream, can actually cause confusion or personality changes. Anemia, caused by an inability to absorb B12, can cause dementia symptoms and cognitive changes. Also, nutritional deficiencies, chronic alcoholism can result in nutritional deficiencies and dementia symptoms, and it can severely impair mental abilities. Severe vitamin B3, B12 deficiencies can cause dementia symptoms or neurological illnesses. And also dehydration can cause confusion that can result in dementia. And finally, emotional problems, confusion, apathy, and forgetfulness that are associated with depression are sometimes mistaken for dementia, particularly in older individuals who can be less resilient. Infections such as meningitis or encephalitis, which are infections of the brain membrane, can cause confusion, memory loss, or sudden dementia. Untreated syphilis can damage the brain and cause dementia. And then finally, normal pressure hydrocephalus. If cerebrospinal fluid builds up in the ventricles in the brain and then the brain is compressed, that compression can cause dementia symptoms. And then finally, when the pressure is relieved, then the symptoms can resolve. So if you know somebody who's having some dementia-like symptoms like memory loss or some of the cognitive changes or emotional symptoms, it could be Alzheimer's, but it could be one of these other diseases or even a metabolic or nutritional deficiency. So you definitely want to get them evaluated, and sometimes the symptoms can actually be reversible. Well, thank you so much for joining us today. Again, I'm Dr. Karen Bierman. I'm a clinical psychologist in San Antonio, and if you'd like more information, call area code 210-445-7324. Thank you.